Today we're going to be discussing the American Academy of Critical Care Nurses Bedside mobile application, available on both the Android and iPhone platforms. Bedside is a mobile application that provides a quick access to a small but useful portion of the AACN's resources. The Bedside app is intended to be used by the nurse working in critical care. There are two main features to the Bedside application. The first is the pocket references. The pocket references essentially give an overview of abnormal assessment findings and help you formulate nursing interventions. The practice alert cards draw attention to high-risk patient safety concerns that are relevant to critical care. The Bedside pocket references are organized by system. In all, there are 10. It is assumed that you would have an understanding of the pathophysiology of each of these systems in order to effectively use these pocket references. Each pocket reference does give a brief overview of pathophysiology, but focuses primarily on alterations within the system and abnormal assessment findings. Depending upon the system, you may find algorithms and in all of them criteria for interventions. What I like most about the pocket cards is that they explain a variety of parameters that contribute to the patient's overall hemodynamic condition and help you to formulate a plan of care. Again, with the practice alerts, there are 10 subjects that are relevant to patient safety within critical care. The practice cards provide a scope and impact of the problem. They address expected clinical practices, provide evidence supporting the problem, and then suggest actions for nursing practice. Particularly interesting to me with the practice alerts is that the expected practice is supported by levels of evidence from meta-analysis down to manufacturer's recommendations. It gives you a clear understanding of who this information came from and how it can be used with confidence that it is truly a best practice recommendation. The usability of this application is great. It's very, very easy to use. It's essentially organized by a table of contents. The main table of contents listing each system, and then the practice alerts. From there, you select what you want to look into. It opens additional content screens where you can further explore, as previously discussed. The pages are plain. There really is no color or graphics to speak of. The pages appear basically as fact sheets. All of the data within the program is embedded with the application when you get it. It's not an intuitive program. There is no search feature. There is no search time, no workflow, and you cannot put any information into the program, so there's no delays with returning search results or workflow. The program is as fast as your phone will load a page. The pocket cards are expert written, but very easy to read. The data is concise and to the point. Overall, very informative. The content is researched and evidence-based and from a trusted resource. There are no legal or ethical issues surrounding the AACN Bedside Pocket app. Again, the information within the Bedside mobile application is from a trusted resource from a professional organization. It is evidence-based. It is data at your fingertips. These are definitely benefits. Unfortunately, the pocket cards you have to pay for at 99 cents each. This can add up, and if you're already a paying member of the AACN, this might not be the best benefit for you, but at $10, it's relatively inexpensive. In conclusion, the Bedside app is very, very easy to use. It is reasonably priced. It's from a trusted resource, and it is a valuable resource for at least a select population of critical care nurses. Is this the application for an experienced critical care nurse with an existing wealth of knowledge? Perhaps not. Perhaps it's better for the nurse who is new to critical care and who is learning the basics.